here's the strangest part. In an 1863 institutional record from a hospital in Vienna, a building demolished in 1911, there are references to tonal treatments. In a Portuguese colonial hospital in Macau, demolished in 1904, local records preserved by a Catholic missionary organization describe large resonating vessels used in the treatment of fever and what the records call disorders of the vital energy. In a charitable hospital in New Orleans consumed by fire in 1887 under circumstances that were never fully investigated, a former patient's memoir describes waking each morning to the sound of bells and noting that her recovery from a condition her physician had called incurable seemed to accelerate with each passing day in that ward. Here's the strangest part. When I started looking for the bells themselves, the physical objects, I ran into a wall. Not a shortage of information. A wall. The bells from pre-1900 hospitals are almost uniformly unaccounted for. Sold to whom? No further documentation. In other cases, and this is where the timeline becomes impossible to ignore, the bells are documented as having been melted down. In waves, in coordinated, almost choreographed waves. The first wave came with the demolitions themselves. When the hospitals came down, the bells came down with them. Some were relocated, most were melted. A few were preserved in museums, stripped of their original context, labelled simply as church bells or civic bells, with no explanation of where they had hung or what function they had served.